With the improvement of living standards, the incidence of metabolic disorders is also increasing. Now, there's much evidence for clinical treatment strategies that combine pharmaceutical medicines with berberine for the effective improvement of several of these metabolic disorders. However, we wanted to know whether berberine has been shown to be effective on its own, and have invited Dr. Paulo in for a conversation on this topic. Now, Paulo, we speak about metabolism, metabolic syndrome, metabolic diseases. There's quite a lot around metabolism or metabolic. Let's first contextualize metabolic disorders as a category.
All right, so metabolism is the process by which your body obtains or creates or manufactures energy from components of food.
Right.
Metabolic disorders occur when certain abnormal chemical processes take place within this normal metabolic environment,
Right.
which then produces too little or too much of certain substances that lead to system dysfunctions, organ dysfunctions, and then subsequent disease.
Okay.
Here we're talking about alteration specifically in the levels of cholesterol and glucose.
Okay.
Okay, and that leads to diseases such as non-alcoholic fatty liver disease,
Right.
pre-diabetes, diabetes type 2, obviously, PCOS, and then hyperlipidemia, which is the isolated event where a patient only has high cholesterol levels.
Okay. So, Dr. Paulo, in terms of ascertaining whether somebody suffers from these, what are the particular markers that we're looking for in people with metabolic conditions?
All right, so the standard clinical markers are done by way of blood testing. Okay, so one will find lower levels of HDL, the so-called good cholesterol. One of the jobs of HDL is to scavenge free cholesterol that may be around the system, so to speak, and take it to the liver. We'll also find an increase in LDL, the so-called bad cholesterol, so it is not being processed by the liver or being taken into the cells as it should be, all right, as well as high levels in total cholesterol, and the fasting glucose levels would also be higher.
Okay.
These are the sort of primary markers. There are other markers.
Right. So let's just touch on cholesterol for a moment. I mean, why do people have high cholesterol?
All right, so there are two possible factors playing a role. So there is the intake of cholesterol from your diet. So cholesterol is only present in animal foods, or foods from animal origin, not in plant-based foods.
Right.
But there is another component which I personally believe is much more important and plays a much bigger role, and that is the fact that cholesterol is essential to life. So cholesterol is used for the production and maintenance of cellular membranes, for the production and maintenance of myelin sheaths, the covering of nerves in the central nervous system. It is used for repair of normal tissue, for building up new tissue. All steroid hormones, from progesterone to cortisol, DHEA, testosterone, and the estrogens, they're all made from cholesterol. It is the primary raw material. Vitamin D3 production requires cholesterol. Bile production requires cholesterol. So those are just some of the areas where cholesterol is used. Now, I have enumerated these to show that if any of these areas is not functioning effectively, then cholesterol is not being used up where it should be.
Right.
And obviously we are going to see it in the bloodstream.
Because it'll hang around in the
Correct.
system.
So you could have higher than expected cholesterol levels and it would have nothing to do with your cholesterol intake in your diet. But it would have to do with perhaps your steroid hormonal system, which is a classic example, is not functioning properly. All right. So it's very important to remember that, because by remembering that, we should then examine all of these different areas where cholesterol is primarily involved to see if they are operating effectively, especially before resorting to treatment for high cholesterol.
Right.
Because this high cholesterol is high because it is not being used correctly by the body. Where it should be.
I mean, one of the most common treatments for high cholesterol is statins. So what are some of the challenges of this treatment?
All right, so we're speaking about cholesterol and glucose. So the primary one that comes to mind is that statins can induce high glucose levels, which means they can't be given alone to diabetics. So there's the first challenge. All right. Statins can cause swelling of neurons in the brain. And that is primarily because statins reduce the production of coenzyme Q10 right through the body, including the brain. And that induces an increase in free radicals. And that has become an independent risk factor for the onset of dementia. The long-term use of statins, it is proven as an independent risk factor for this challenge. And of course then we have the common side effect, which is muscular pain and muscular damage. And approximately, it is understood 30% of patients cannot continue to take statins because of this side effect alone.
Okay. Now, Paulo, we understand that berberine is often used as an alternative to statins or along with statins for those who don't tolerate statins so well. But is there a reason why you would use them together and you can't just use berberine on its own? Is it effective on its own?
Yes, all right. So there's a lot of research on berberine. PubMed, which is a database accessible to the public, has at least 6,500 published articles on berberine. A meta-study or meta-analysis was done of randomized clinical trials with berberine alone. This was done in 2021. It was published, if I remember correctly, in the Journal of Pharmacology, Frontiers of Pharmacology. And it was shown there that berberine alone, so they looked at clinical research using berberine alone. It reduced total cholesterol, it reduced LDL, the so-called bad cholesterol, it improved the so-called HDL cholesterol, and it reduced blood glucose levels.
Okay, interesting. So it's doing what the statins would be doing, but in a more natural way, if we correct that?
You could say it that way.
Okay, so let's talk about that. What exactly does berberine do in the body which helps with these metabolic conditions?
All right, so berberine regulates at genetic level these genes that are involved in fat formation. So for example, in skeletal muscle, what it does is it increases the heat consumption and the oxygen consumption, which then in turn leads to a faster metabolism and the usage of glucose, for example.
I mean, as you say, once we're getting the system working properly, it then starts to utilize the resources in a good way. So they're no longer just building up in the system.
Yes, correct. So in other words, especially in patients with metabolic disorders, the fixing of the various systems, if I can put it that way, will mean that these patients will go from accumulation of glucose and cholesterol to decomposition. Okay. In other words, to the utilization of these substances the way they should be utilized, and consequently the levels will normalize.
Okay. So Paulo, into our Real Health Medicine cabinet, we've dived in and found BioBerberine Advanced. This one is with Berberis. Tell us why this particular berberine product is one that is worth looking at and considering for your supplementation.
All right, so the berberine source is from a worldwide known reputable source. It also contains chromium and green tea extract, which amplify its effects on blood glucose control, for example.
Okay.
So in other words, this is a very high quality product.
Okay, great. And Paulo, I mean, we've spoken about how this sort of gets the system running efficiently and properly. So if you are on statins or on diabetic medication, should you be keeping an eye on dosage and possibly moderating that with your practitioner?
Yes, definitely. So patients that are on hypertensive medication, because hypertension is linked to glucose management as well as cholesterol management. Right. So on hypertensive medication as well as glucose or cholesterol lowering medication such as statins or metformin, they must watch their levels.
Right.
Because it is going to happen, it's all a matter of time, if berberine is taken correctly, that their medication will have to be reduced or discontinued.
Okay, right. And Paulo, any contraindications for anybody who is taking this? I mean, beyond those taking medication, would there be any?
Yeah, there's one contraindication. Some of the researchers found that if you are taking antibiotics, you should stop taking berberine for the period that you are taking antibiotics for.
Okay.
Because it may affect the efficacy of the antibiotic.
Right. And finally, of course, always want to know where we can find this product.
I believe it's available in health shops and pharmacies.
Wonderful. Paulo, thank you so much. Some great advice there.